Hi, this video is on neuropathy. I'm Dr. Shakib from Irvine Spine and Wellness Center, your Irvine chiropractor, so stay tuned. Thanks for watching. Let's talk about neuropathy. You can have neuropathy in your arms, your legs. Let's concentrate on the ones that are in the arms. It used to be called RSD, or reflex sympathetic dystrophy. Of course, it was mistreated forever, it seems. And then now that you don't hear RSD or reflex sympathetic dystrophy anymore, you hear what's called CRPS. What does that stand for? CRPS is complex regional pain syndrome. I had to look at it because I had to think whatever it was, so I wrote it down here. So it's called complex regional pain syndrome, and what it is now it's not just one symptom, it's a whole bunch of symptoms. What does that have to do with it? It has to do with irritation. We're not talking necessarily on impingement. Impingement is like real pressure. You can irritate the nerves and the arteries, and really neuropathy means disease of the nerves. But really, true treatment for neuropathy does not just address the nerve component, but it addresses all the structures that come from your neck. They go through this triangle right here to your armpit and down your arm. So really there is there are arteries, veins, the nerves, there's lymphatics, all of those have to be addressed. So the reason I'm doing this video specifically is when you have an irritation of a nerve as a result of this pathway I just told you about, you cannot have just a nerve irritation because there are other structures that go there. If anything irritates that same series of things that are irritating the nerve are going to irritate those other things. So that's why RSD, reflex sympathetic dystrophy, is an obsolete term, and now we're talking about CRPS, and we're also talking or hear everywhere about neuropathy. So what is it that I do in my practice for these things? I actually use cold laser in those instances to facilitate the rejuvenation of the tissue. I also work on this pathway to clear that irritation. Neck adjustment plays a huge role here, guys. Working on functional movement and active release technique on this area and the surrounding muscles, front and back of this region, including the shoulder, is another one. Subscapular, under your shoulder blade, is another area that I find absolutely 100% of cases it's an issue there. I also do what I consider, and I don't even know if I made this up or what, but I consider it a lymphatic pumping, where you want to facilitate the lymphatic drainage here. So these are some of the things you can do. I think I did a whole video on lymphatic pumping on my YouTube channel. So if you haven't subscribed to my YouTube channel, this is your opportunity to subscribe to it. Check out under playlist. I try to put things under playlist so it's easier to find them. Also, I absolutely recommend you follow and like my Facebook page, Irvine Spine and Wellness Center. That's where I do interviews with outside experts on a subject matter that I pick at the beginning of every month. And then the videos are available on the Facebook page for the office. I also have biohack ebook that are 17 different tips I do every single day and every single opportunity. That's because my health is in my own hands, so is yours. You should do everything you can and learn about health so you can enjoy your life better. Hope this helped, and ask me any questions, shoot me an email, or follow me on my different platforms. I'll make sure I put it in the description box. This was a blast, and I look forward to doing more videos with you. Take care.